And welcome back to the podcast. I'm Dr. Christopher Nolikin.
Hi, I'm Dr. Lindsay Renzullo.
Lindsay has a cold today. She's been deathly ill.
It's
so
just terrible.
We're just going to try to deal with it. She's got a cough drop in and everything. She's good. So today we have a mixed group of topics. I think we're going to do a bunch of Ask the Vet kind of questions. We have some interesting cases we were going to kind of talk about. But we're going to start off with a news article that happened to pop up in my feed today, which was a therapy dog attacked a service dog at a restaurant.
Yeah, I mean, and it's
interesting.
Very interesting, and I think that the way that you said it makes all the difference. She's talking about, different types of dogs that are either service dogs or therapy dogs, and trying to figure out the distinction between the distinction.
So we see these articles actually fairly frequently. If you Google, therapy dog, you probably will pull up a fair number of issues where there was some sort of a behavioral incident with a therapy dog on an airplane.
Yeah.
And there have been a couple of attacks or bites or things like that happened.
Yeah.
You had found one that was serious one.
We were Googling just before, before we aired today, and we were saying, therapy dogs attack or something, and there's just article upon article, and there was one that a 6-year-old boy had gotten killed, another one that a man got killed. So, I think it brings to light, something that's important. One of the great things that animals do is they can help a lot of people through a lot of different things. And I think that there really is something to be said about a special, human-animal bond. And so I know I have a lot of clients that have therapy dogs, but figuring out what the distinction is or what the difference is between a therapy dog and then an actual service animal, there is a big difference. And
actually, I should say, it was emotional support animals. So there's actually a different category.
That's true.
Therapy versus emotional support. So I apologize to all the therapy dogs out there.
Yes, that is true.
So distinctions are service dog. So when you think of a service dog, you're seeing eye.
Yeah.
Right?
Yeah, you're dealing with dogs that have had a high degree of training to get to that point to get certified as a service dog. So those are typically the dogs that people have always thought about historically. They wear the special vests. They're helping people that are blind, that are impaired in other ways, might be paralyzed or somewhat paralyzed.
Sometimes there's seizure sniffing.
It's true. You can get diabetic dogs, right. Dogs that can actually sense when a patient's glucose level is off. So those service animals are dogs that have gone through extensive training and certification.
So those dogs are generally permitted any place that a person is permitted.
Yep.
So they're kind of removed from all the rules. This is a place where pets are not permitted, but service animals are allowed. They do have to be official service animals. This is not just a dog that you've decided provides you comfort, or your psychologist perhaps has decided that this would benefit you. This is a bona fide service animal with those certifications. They usually have gone through, they've usually been fostered for a year while they got trained. They often go through additional training after that. And so those are official service animals, and they do have a special legal distinction. They're also, honestly, they are very well behaved. Mm-hmm. They are model canine citizens, and so they are not usually the issue in terms of any of these behavioral incidents. They're sort of the perfect dog.
They really are. I mean, and because they've been through such a rigorous protocol to get to where they are before they're actually released to be an official service dog for a person. Some dogs actually don't pass. So you have a lot of dogs that go into the program as if they're going to be service animals, and they may just be a little bit too rambunctious. I have one patient of mine that is a failed service dog that is honestly the sweetest lab ever, but she just honestly loves food way too much. She couldn't focus. And if anybody had a sandwich, anytime they brought her to a restaurant, she would just leave the person and go to the food. So she's the sweetest dog ever, but she failed as a service animal.
And that's actually a very high percentage. I don't know the numbers, but it's more dogs fail service training than actually pass through.
And then you have therapy dogs. And therapy dogs and emotional support dogs, I feel like there's sometimes a gray zone. And there is a little bit of sort of the differentiating between the two. When we deal with therapy dogs, as compared to emotional support dogs, have a little bit more training, I guess, if you would.
So they have to go through a certain canine good citizen training, and usually a therapy dog is certified to, for example, go to a facility like a nursing home or a kids care facility. That therapy dog is there to hang out with the people, the residents of the facility or whatever it is, and they're to provide just fun and stress relief and that kind of thing. And the facility usually requires a certain level of at least vetting of those animals, right? They have to be good around people. They have to never show any signs of aggression. They have to have certain basic requirements.
Yep.
Those guys are allowed at those facilities. That therapy dog is a therapy for that facility or multiple facilities, but isn't necessarily given any other special privileges anywhere else.
Yep. And then we have this sort of category of emotional support, which is kind of up and coming, I would say. Like maybe in the past 5 years, this particular category has really exploded. And it's exploded because, there's a lot of access with the internet now of being able and going and getting your dog sort of an emotional support. And whether or not that is because of your human doctor sort of giving you, guidance and this animal is good for you, maybe we should have this be an emotional support animal. Or sometimes people on their own accord can just go online and basically register their dog for a nominal fee, get a vest, get a collar, and then that dog becomes an emotional support dog with no training or no kind of vetting process at all.
And there are laws in place that say specifically for housing and for air travel, for some reason it's those two categories, that if you say your pet is an emotional support animal, it theoretically is allowed to live with you, even in a non-pet friendly facility, or travel with you. I think the problem is that there isn't a distinction that says this is an emotional support animal.
Yeah.
And these are the rules behind it. So for a while, it was kind of, if you said your animal was an emotional support animal, then this all worked. Yeah. But now, with all these incidents of attacks, or people trying to bring very non-traditional animals as emotional support animals. So there was this is what we talked about before.
This is what we talked about before.
There was a peacock. There was some sort of a rodent, like a hamster, which technically rodents are not permitted on that particular airline, so they couldn't let it go. Okay. Yeah. People will bring hedgehog, I think was another one. So, but what you consider your emotional support might not be commonly accepted in the world as this is a valid support. And then you also run into the issue of, are you going to have... I think the person with the peacock actually bought a seat for the peacock. But, now you've got 3 rows, you've got a peacock sitting next to you, and you bought a ticket too. It's a very interesting dynamic.
Well, I think the thing, too, is that a lot of these emotional support dogs, while they may be really good for that particular person, and you might have a really special bond with that particular animal... that animal might not do very well in certain circumstances. So that animal, even though that animal provides you with a lot of emotional support, that animal might not be the best flyer, might get really anxious or nervous in that kind of a situation, or might not like other animals. So if you're bringing them to an area where there are other animals, and that's where the problem happens.
Or kids, if you haven't... So if there's no rules, then you really, it's kind of this animal that you're bringing might not be well enough trained to do this. So I think the guidelines that I would kind of provide with people is, and this is actually true of coming to the vet too, how many times do people come to the vet and say they're fine and then they bite you, Right. So you do have to have some awareness of your own pet's borders, know, what they will manage to handle. And no emotional support animal should ever travel in a situation unless they have shown that they can handle that. You need to know that your animal is okay with other people. You need to know that they're okay with other dogs. Right. And the airlines are trying to clamp down on this. Have you seen some of these forums?
Yes. Yep.
So they're trying to get us as vets to say this animal's fine, which most vets will not do because I haven't experienced your animal.
Yeah. You just can't.
I can say no if I see worrisome behaviors, but I won't say, this is fine for her, because I'm not going to be willing to take on that liability.
Yeah, so I don't know. I think that, as time goes on, you'll see some changes in what airlines are permitting, globally or universally across the board. And same thing with restaurants and other things, because, even though, like I said, it might be good for you, it might not be the best for the animal. It might be putting the animal in a difficult situation. So it was an interesting news article that you picked up on. I like that. Yeah.
It's, I also think that this whole category of emotional support, the warning that I have for people is calling your pet an emotional support animal is not a way to avoid paying excessive airline fees for traveling with your pet. So that's not okay. I have had some owners that came to me that said, well, if it's an emotional support animal, then I don't have to pay to put it in cargo or whatever.
Right.
That's just not an acceptable thing to do.
Right.
Yeah. And that's how we'll end it, on a negative note.
Well, the rest of the episode should be nice and fun. Yeah.
Do you have any questions that you came up with for us?
Yes, actually, we have a...
This is Lauren.
Hi.
Our executive producer.
Our executive producer.
How can I prevent my dog from getting ear infections?
Oh, great question.
Which she is known to get.
Yeah, that's a great question. Yeah, so, I mean, dogs that have ear infections, I think, she wants to know how to prevent them. I think what you should figure out first is why is she even having them to begin with. So, a lot of times dogs have ear infections because they have underlying reasons that they would have that. So, they either have an underlying allergy to something, either in their food or in their diet. They might have an anatomical abnormality that makes them prone to having an ear infection. They might be dogs that are constantly swimming and getting water in their ear, just making it, again, a nice environment for yeast and bacteria to grow. So I think the thing that's important is if you want to stop getting ear infections, or you want your dog to stop getting ear infections, is trying to figure out the underlying cause. Because just cleaning your dog's ears once a week is not going to cut it. It's not going to stop that underlying problem. So it's getting down to the bottom of it, and sometimes it's annoying, right? Like, I mean, doing testing and trying to figure out why your dog is getting recurrent ear infections, it's not a simple test, and there's not a simple thing for you to do necessarily at home. It can sometimes take a little bit of work.
Yeah, I think people greet me with a lot of incredulity when I say to them that their dog who gets an ear infection in the right ear every 3 months might have a food allergy or another type of allergy. So part of the issue is convincing you, the owner, that there is a reason for this, and it isn't just that my meds aren't working.
Right.
And that if we can bridge that and we can say, okay, now what can we do? Well, yes, you might need to do a food trial because one ear keeps getting infected. And I know that seems crazy.
I know.
That no, your dog is not itchy elsewhere. No, you're not having any of these issues. But that could be the only sign that your dog has of an allergy.
I know.
And do you find that? I mean,
all the time. I say to people all the time, because they say, well, it sounds so strange, it's a food. I said, I'm telling you, dogs are just funny little creatures. When we have food allergies, people always go to like peanut allergies or shellfish allergies. Like your throat's going to close and your face is going to swell and you're going to throw up.
Or you're allergic and you're getting like respiratory symptoms.
Right.
But that's not what dogs do.
That's just not what dogs do. Because people don't get chronic ear infections, so it's hard for them to understand why this chronic ear infection could be a food allergy.
And always the answer is, but it's the same thing. It's always yeast. Yes, it is. But it's not the same yeast.
Yeah.
It's new yeast.
Yeah. Yeah.
Which is hard. It is hard.
And I mean, ear infections or any kind of chronic skin infection, any of these chronic, if it truly is because of an allergy, are one of the most frustrating things for owners. Because I mean, I'm Italian. I love giving my dogs all different types of food. I love not having to worry. I love not having to worry that she has a food allergy. But for the owners that have dogs that have food allergies, I mean, it's really hard. You can't give them chicken. You can't give them beef. You can't give them certain things.
Whatever it is they're allergic to.
Yeah, that they might really like and you want to give them. So it's hard.
Yeah.
That's a good question.
Yeah, we have a lot of them. Yeah. So the next one is it's from Sammy, who actually wrote in on the Mass Vet Facebook page.
Okay.
When will the new location be open? And how will the facility differ from your current location? Will emergency offer services like 24-hour X-ray?
Wow. Well,
okay. We already offer that now. So that's a good public service announcement that we already offer that.
Yeah.
So we're moving officially, unless something changes, which you never know, but our official move date is going to be June 25th.
Woo!
Very exciting.
It's really exciting.
The new facility, we're trying to have as little downtime as we possibly can. We are going to have some gaps when we're moving our x-ray equipment or something where we can't provide a certain service during this 4 to 8 hour window, whatever that might be. So on that day, we will only have emergency services, and it's really going to be mostly people that walk in because they didn't know. We're trying to divert things that particular day, but we'll post all that information on our Facebook page and when people call in. And hopefully we'll be up and running sometime the next day, the 26th, and ready to go.
The new building's beautiful, though. I mean, it's going to have, just state-of-the-art, diagnostics treatments. Not that we don't have it now, but one of the really exciting additions that we're putting into the new building is a CT scanner, which is pretty exciting. The reception area, I think everybody who's been to the old Bulger will just be really wow with the new reception area. There's a special quiet cat area, so cats can kind of go and have their own little section. They don't have to worry about having all these dogs in their way. Yeah, scaring them in their carriers. They're stuck. But it's absolutely beautiful. It really is.
Yeah, and I think, the idea is that Bulger has always offered a pretty wide variety of services, but it wasn't obvious. We have a relatively non-assuming brown building on the street. It doesn't look that big. So the new facility improves our workflows, gives us more exam room spaces. Right here we have 9. There's more than double that. So it's just giving us the space to actually do the work that we're doing, and then a few additional diagnostics such as the CT and the ability to have additional specialties, which we hope to at some point add to our hospital. So
we will be having little open open house and things like that we'll be posting lots of pictures on Facebook. So keep looking at our Facebook page, because there'll be lots of new pictures there as we're getting closer to the opening day.
And we do hope to do a little tour of it for our next podcast, which we'll announce the date for that soon.
Yeah.
This next question from Anne Marie. We adopted a Frenchie in November. He turned 2 in February. He still has very bad habits we are not breaking. Doing his business in the house a lot, she puts in quotations. He is walked for 20 minutes, doesn't do anything, then walks in the house and pees and poops. He also turns around quickly and eats his droppings and eats everything he can. Any advice?
Any tips?
Yeah, behavioral problems can be really hard, because I feel like a lot of times, if a dog has a urinary tract infection, you give them antibiotics, they're done, you did a great job, you feel really good about it, you walk away. With behavioral problems, there's a lot more that owners need to sort of invest into it, and it's not as quick and as easy as a fix as a pill. Behavioral problems, I always tell people, whatever it is, you start back at square one. So, if the main problem that you're really having is this whole peeing and pooping within the house, it is sort of re-housebreaking him. I know it sounds like you're taking him out frequently.
Or maybe he never was fully housebroken to begin with because he's a puppy, right?
Yeah, that's true. That is true too. But not necessarily giving him full access to the entire house where he can run around and pee and poop anywhere. Keeping him sort of, crated or gated off into an area like a kitchen or something like that, and making sure that when you're taking him out, you take him outside. If he goes outside, there's got to be a lot of positive reinforcement. You bring him back inside. I think those are the big things,
Yeah, I always tell people with that issue that, dogs have to learn, when they're learning house training, they have to learn 2 main concepts. One is, it is good and desirable to go outside. And 2, it is not good to go inside. And those are actually separate. So It's not like you could get one where they know that it's good to go outside, but they also don't have any idea that you don't want them to go inside, and vice versa. So that's the positive reinforcement. And get the yummiest treats ever to encourage them. Every time they do, you go outside with them every single time. You don't open the door and let them go out. You are out there physically with them. The minute they go, you give them a treat and make it the best day of the world. And then on the flip side, on the inside, you cannot let them leave your sight at all. You have to, some people will put them on a leash. My deaf dog, who I couldn't yell out across the room, she was on a leash with me for, I'm not even joking, 6 months. It took that long, and it really does take that sort of hardcore adjusting to get them so that the minute they start to show that they're going to go, you are going to pick them up and you are going to bring them outside, and then when they go outside, you are going to give them a yummy treat.
Yeah.
So that they never have that accident in the house. Most of the time when they have the accident in the house, it's because they snuck off.
Yep. And the behaviorists that I worked with at school said, if you can make a loud noise, if you see them doing it, hey! Something
shake a can with,
something, right? Sorry about that.
Pennies.
The sound goes really up.
Really
sorry. Woo!
Blew out our audience.
Blowing out the speaker. I'm so sorry. Oh God, now I'm hitting it.
Some people just crashed their car.
I'm so sorry, everybody. But a big loud noise, to kind of disrupt that behavior, stop what they're doing.
It just occurred to me that maybe some people just peed their pants.
Maybe some people did. They got so nervous
because she yelled. Anyway.
But the old school mentality of taking their nose, let's say they went to the bathroom and they pooped in the house. And then you'll find it 10 minutes later.
Or an hour later.
Or an hour later. Or whatever. You're like, oh, geez. the old school mentality of taking that dog and then taking his face and smearing it in there and saying, no, it's so old school.
Because all they know is, Mom's putting this poop in my face
and saying no and yelling at me, and I don't really understand
this
why.
Dog might like.
This dog might. I try to eat it. And eating the poop, that's another good thing.
If I could solve that, I'd have millions of dollars, just to let you know.
I mean, it is. It's really hard. Some dogs just like eating poop, and sometimes it's a behavior they just outgrow, and other times they don't. There is that stuff that you can put into their poop or into their food.
You can feed them something that makes their poop taste worse.
But their poop already, I would think, tastes bad.
Well, but
they say it works. Some people say it works.
Some people will say go around after they poop and put Tabasco sauce on their poop, which is, again, it's a negative reinforcement thing, right? So you'd think, just pick it up. Well, but that doesn't teach them in theory that when they eat it, they get the yucky Tabasco sauce. Not every dog cares about Tabasco sauce, but that's one way. Or just being really diligent at picking it up.
Yeah, it's a tough
I know my little dog likes the poopsicles when they freeze.
Oh
yeah.
It's terrible. All right.
Actually, one of the next questions she kind of touched on, I just don't want her to feel left out. Brienne asked, how do you stop poop eating? Her 17-week-old puppy is such a poop eater. So you guys did touch on that.
I mean, for the puppies, my opinion is just pick it up.
Pick it up.
You should be probably out there anyway because you're doing the positive reinforcement and all of that. But yeah, I mean, there are dogs that still continue.
It is. Some of them outgrow it for sure, but some of them just, they don't. And
but you can try sprinkling it with a little Tabasco sauce. Every single poop you find, sprinkle it with Tabasco sauce. Or try those enzyme treatments that you can get at pet stores.
Yeah.
It's called coprophagia. And
there's a couple of brands. Forbid is one that I've told people about, and they've gotten it. So.
This is from Sammy. Just lost one of their dogs.
Oh, we're so sorry.
Dogs grieve?
I think so.
Yeah, I mean, that's a big, hairy question.
It is a big, hairy question.
Yes. We definitely see behaviors that I would say the dog certainly is missing something.
Yeah.
Right? So the companionship that another dog had, they'll go looking for them.
Yeah.
Right? Or they'll go sleeping in a spot that the other dog used to, that kind of thing.
I do think it's hard because sometimes, there are some people that believe, putting human emotions and trying to attach it onto dogs, is not necessarily the most appropriate thing. I don't know. For me, I'm a big softie in a lot of ways. I do feel as though those pets will grieve. I do think that some of that behavior is pet missing the companion. I've seen dogs that, might have been separated for a variety of reasons that then get back together. They're just so excited. And they know the difference between that dog and another dog off the street. So I do think that, if you have two dogs that are very bonded and one passes away, I do think that there is a little bit of a grieving process that other dog will go through.
The problem is, what is your definition of grieving?
Yes.
So is it feeling depressed and sad and not, I don't know if those emotions are experienced by dogs, but they certainly experience the change and the loss.
Right.
And I mean, sometimes you will also see just general behavioral changes, both good and bad, with pets. So I know my mother-in-law's cat really was skittish and crazy. And it was very hard to interact with this cat. And then the other cat passed away, and all of a sudden this cat became so friendly. And it was that other cat was perfectly nice, but was maybe inhibiting the behavior of this other cat. So it's just, it's interesting sometimes that you'll see sometimes positive changes. Sometimes the dog will or cat will kind of go and seek out more human companionship when their pet companion is gone.
Right. I do, but I do think there is some significant behavior changes that can happen with some pets. Some people say that one pet dies and the
other one's gleeful.
Yeah, the other one's gleeful, all really happy, but they couldn't notice a difference. The other dog doesn't seem so. I do get the huge spectrum of some dogs seeming to be very affected and other dogs not, and same with cats and stuff too. Yeah.
This is a good question that just came in from Elise. 10-and-a-half-year-old yellow lab is on Rimadyl and gabapentin for arthritis. Is there something else we can do to help him, or laser treatment?
Oh, yeah.
I have heard a bit about this. I'm not sure what it does. He still seems like a puppy, but does drag and shuffle back paws on walks.
Oh, yeah. That's a great question.
Yeah.
So, I mean, those two medications that she stated are sort of, standard as far as arthritic medications, trying to make the pet more comfortable. But anytime I have a pet with arthritis, I tell people, you can we have our standard medications, like oral pills that you can give to help the pet. But then there is this whole other spectrum of things that we can do to help your pet to make them more comfortable. We can do everything from looking at the weight to seeing how heavy they are, if they need to lose weight, acupuncture, laser therapy, water therapy, the diet, the physical therapy, rehab. There's so many different avenues now that we have. And what I find is that sometimes maybe one thing works really well for one patient. I have a few patients that responded really, really well to acupuncture, and they didn't really think the laser did much for them. And then I have a total flip, like some patients that think that, or some people that think that the patient responded really well to laser, but maybe not as much acupuncture. So, it's not a one-size-fits-all type of thing, but there are so many other cool modalities that we can use to help those arthritic patients.
Yeah, usually I kind of suggest that, if you're amenable to it, seeing a canine rehab or physical therapy specialist first is a good avenue to go, because oftentimes they know the different other modalities. So the biggest thing is that that as you are having pain issues, you stop using the joint or limb in question, right? So dogs beneficially have 4 limbs.
Yep.
But that means that when their hind limbs are bothering them, they shift a lot of their weight to their front. We all see these dogs that have, I haven't seen it too much in cats, but dogs that have these really bulky, actually, front limbs, and their little hind ends are these little tiny things because they're just not using it very much.
Yeah.
And so that's the idea with rehab and physical therapy, as we talked about last month with Mike, is to try to get them using those joints and trying to get them using them equally, because it's actually better for them to use them. So that's what rehab is. Laser therapy is often used in conjunction with rehab or physical therapy to just generally increase blood flow and increase some of those good inflammatory mediators to try to keep those joints in question with good blood flow and less painful. And so they use that in conjunction. There's other things. They'll use TENS. Yeah. They'll use ultrasound therapy. Sometimes underwater treadmill helps because it increases the pet's buoyancy so they can actually walk more normally on their limbs while they're using them. Acupuncture also helps to improve. So it sounds like it's this like woohoo acupuncture, but it's actually based in science, where you're actually exciting or reducing stimulation at different nerves, and so that's beneficial. Every pet's gonna be a little different.
Yeah,
there's a lot out there for you.
Yeah, but definitely. So
you could actually go back and listen to our rehab talk last month, because we did talk with a rehab doctor who kind of went into a lot of that.
Or then you could just touch base with your regular vet, and I'm sure they'll be able to help you figure out the best path for your pet.
Yeah.
Our friend Anne-Marie again. So Cooper, her dog, eats everything on walks. What's the best way to stop this behavior? Muzzle?
Well, I start with a very basic training. So when you go to a training class, one of the most important commands is leave it, and that's a tough one. I never got that far with my dog.
Step one. Really Step one fail.
My dog is not a model citizen. I would never bring her to a restaurant or say she's a therapy dog or a companion.
She's very sweet.
She's awesome, but so leave it is a really important command. And so if you do basic training, it sounds like if that's the same dog that was having house training issues and maybe some the coprophagia, a basic training class might actually be really beneficial. What else do you do when they're on walks and they're eating everything?
It is really hard. Our producer sort of mentioned it. She used to be a technician here, so she's familiar with some of the stuff. Basket muzzle is something that you can have your pet wear. Not a lot of people love it because it makes your dog look vicious, even though it's not meant for that. It's a muzzle that still allows the dog to open and close the mouth and, pant and do all the fun stuff and still bark, but he actually just can't, or she can't, go over and actually eat something. And we do have some pets that are on this that are like just chronic, like rock eaters, or they've come in and they've had like 4 or 5 surgeries to have, rocks or, tennis balls taken out of their stomach, and they just can't be left unattended. Wear a basket muzzle, but that's it is an option if it's...
Well, another one is not quite to that extent, those gentle leaders. So I had a basset hound. I lived in Philadelphia. I'll tell you a story about that later. But he would eat anything, and people left a lot of just garbage on the streets because I didn't live in a nice part of Philadelphia. And so there would be things that might be considered dangerous. You'd have chicken bones sometimes on the street that people were just eating and tossed. And so the gentle leader is not a muzzle. It goes around the nose. There are those available for Frenchies for the little short nose. But then the minute you see them eating it, you can just do a gentle pull it away, and they won't be able to get at the thing. It's not painful or anything. It just pulls their head away. So that's another, like, in between. It's not a basket muzzle.
Yes, yeah.
But here's my story. I lived in this terrible place in Philly that I really didn't like. And walking down the street one day, my dog went to get, like, a chicken bone. I was sure it was a chicken bone. I always used to reach my hand in there and pull the chicken bone out. And this time I reached my hand in there, and it was poop.
Oh my God.
There were people, living in our neighborhood that didn't have homes, and it was just something about the smell of this poop. I was like very sure that this was not dog poop. I don't know.
Oh my God.
I had to walk home with the poop on my hand. I was so mad at my dog. Going back to the poop eating, I've had some really bad dogs.
Oh, jeez. That's terrible.
So you generally should try to get the thing out of your pet's mouth unless you think it might be poop.
Then let it go.
All right. Next question. Do you have any other questions, Lauren?
Yes.
Oh, good. Do you like my story?
I did like your story.
Okay.
So this is from Sammy. Dr. Conway has helped Lily, who has IBS, with homemade balanced diet. Dog food is a hot topic. What is your view?
About dog food or
about homemade diet?
I think homemade.
Yeah.
Yeah, I mean, we did do a podcast a few months ago on homemade diets. Yeah. I think homemade diets, there is a place for them. I think that, if done appropriately, they can be good. I think the big key is just done appropriately, because homemade diets, it's not as easy as you might think. Mm-hmm. You need to make sure that they're balanced. There needs to be appropriate, like, vitamins and minerals and everything in it. And so figuring out, getting appropriate resources and making sure that you're doing it right, I think is important.
Well, and so the way that this particular owner is doing it is in the context of seeing a veterinary nutritionist.
Right.
And that's the right way.
Yes.
As I think we talked about it that other show, was the wrong way is just to make up some chicken and rice and feed it. The right way is to have a nutritionist give you, some vitamins, mineral mix or whatever, and give you a recipe that you're going to follow, and that's perfectly fine. And it's often a way to manage some of those really refractory cases of IBS, inflammatory bowel disease, and those things.
Here's a question from another page. My dog, an Australian Shepherd, has lots of small bumps. Do you test all the small bumps to figure out what it is, or just one? What do you have to do?
That's a good question.
Well, so it depends on the size of the bump. So there's some little tiny bumps, and sometimes they're like on the eyelid or the lips, and there is no conceivable way I'm going to get a needle into it, at least awake, and suck enough cells out to get a diagnostic sample. So for little tiny things, do you agree? Often that's not possible. Some of them they have a very classic appearance, and while we're not supposed to really assume anything, there's like little warty things.
Right.
We usually are very sure that those do not need to be tested and that they're benign.
Yeah. So, I mean, I think it's hard because, every dog is so different, and you can get some dogs that you look at as a veterinarian and you're like, you know what, to be honest with you, I'm not super worried about this. Right. And can I tell you with 100% certainty? No. But at the same time, I'm not super worried about this little Australian Shepherd having lots of little lumpy bumpies. On the flip side, you can get some dogs that produce sometimes, or they're just known for developing certain types of tumors that are skin tumors. And
the great pretenders, they're called.
Yeah. So mast cell tumors are the tumor that we probably see most often, that you can feel and see on the dog's skin, that is something that's cancerous that you do want to take off. And those can be super teeny tiny
and
too.
And they can look just like warts also.
And they can. I mean, I took one off of a dog a couple weeks ago on the inner thigh. I kid you not, I wouldn't probably have ever noticed it on a physical exam. It just was, this dog had a history of mast cell tumors, and sure enough, that was the start of a little baby mast cell tumor. We took it off and got rid of it. So I do think you have to kind of look at the individual dog and what you're dealing with. Because very often we'll have like little Bijons or little white dogs that have all these little growths all over them. And to test them all, to stick your dog 20 times with needles, it's probably going to be fine. I don't force people to do it. But we have to see if you do have a boxer that's known for getting these mast cells and all of a sudden a new mast pops up. We sort of look at that a little bit differently.
And I would say that, yes, the ideal situation is we definitely would want to test each individual one just once. You don't need to test it every single year, but you keep a nice record of it. You keep a body map where you say there's this mass and this year it was 1 centimeter or inch or whatever. You measure it, and then the next year it's 4, and the next year it's 6. It's getting bigger. We should watch it. So that's the best way to do it. But with some of the little Cocker Spaniels, Bichons, they're just very prone to these little warts, and so we'll look at it and say, it's just a wart. Yeah. Now, I will say I had a dog once that was not in a prone breed that I did not aspirate this thing that looked for all the world like a wart, and then the next week I was like, you know what, let's do that, and it was a mast cell tumor. It was this tiny little, I don't even know how we got the sample.
Yeah.
But they do sometimes sneak by you.
Yeah, it's sort of like when people go to the dermatologist. Even my dad, oh my god, if he listens to this, I'd be so mortified. I feel like my dad's got all these things. No, I don't think so.
Oh, okay.
I'll tell him not to. We didn't air this month, Dad. But he'll you do the body scans where they flip around and look, and I feel like the dermatologists test the ones that they don't test every single one. They test the ones that,
it's like
but they know, right?
Yeah.
Right.
This is our friend Anne Marie again. First, she says, "Hi, Dr. R."
Is this Amber? What's her last name? Is it Furtado? I can't say it. Oh, I did it. I'm so sorry. Sorry, Anne Marie.
I
don't think she minds.
James Grandma.
Oh yeah,
yep.
It is. Yeah.
So where can she find a muzzle for Cooper?
Oh, pet store.
Yeah. You order them online, I bet too. Either one.
Yeah, but you're specifically looking for a basket muzzle, not.
Are you gonna get a basket muzzle for him? Yeah.
Yeah,
He's that bad. He's getting that bad.
Sounds like it. Yeah.
So for your Frenchie, you're gonna want to look for one that's specifically designed for either brachycephalic or just search for French Bulldog basket muzzle, because they do fit a little differently. They fit a little wider around the face for that.
And maybe even try a pet store so you can try them on.
Yep.
Yeah.
That might be a good idea. You can bring them right in.
Yeah.
Good tip.
From Sammy, I always use a seatbelt for my dog in the car. Do you see a lot of injuries from car accidents? From unsecured dogs?
Thankfully, we don't get that many car accident dogs. We will get a few. We get, I would say, a handful a year that might have been in a car accident with the owner. Thankfully, we don't get that many that come into us. But theoretically, any type of traumatic event like that, if it was a serious enough car accident, you could have trauma from just the dog hitting the dashboard or the windshield.
Or the owner can get injured from a flying dog hitting them.
That's true too. Yeah, that is true too.
Not impossible.
Or the accident could possibly be caused by the dog if the dog's not unleashed.
The big thing.
And
So oh my gosh, does it drive me crazy to see an owner driving around with their little dog sitting on their lap behind the driver's wheel.
Yeah.
That is.
I used to do that back in the day.
I'm sure you did.
I did.
I
know I did in college. Me and my dog.
Your dog should not be sitting on your lap while you're driving.
Yeah, I know.
Okay? Flat out. Period.
Yeah.
You do that? Either you?
Oh, okay. God. No way. Your dog is way too big for that.
I see big dogs doing that.
Yeah, I see big dogs doing that too. No, I definitely did it when I was in college.
Yeah.
I don't do it anymore.
No, so they should be secured in some way. I would argue, I don't know how safe it is. Your dog's in a crate in the back. Is that, and then the car rolls over. Is the dog protected much? I don't know. A seatbelt, I feel like they are.
Yeah.
At least from being thrown from the vehicle.
Yeah.
I did see a dog one time that was thrown from a vehicle, and it survived. It had a skull fracture, though.
Wow.
Wow.
Yeah.
I don't know how the dog would have fared with the seatbelt, but.
So a few more good questions.
Yeah.
How do I exercise and entertain my cat who is lazy and indoor, and I've been told he's overweight?
All right. So this is my topic.
You take it.
All right. So first thing you need to do is buy a book called The Cat's House. No, I'm not even joking. There are people that have designed parts of their house to accommodate their cats, and while that particular scenario is maybe a little over the top, it can give you some good ideas actually. So simple things. There are some toys that are very great for exercising your cat. Laser pointer. Most cats go wild for laser pointer. You just shine it right in their eyes, but you can use it. Usually I like to, at the end of that, do something where the cat can actually catch the thing, because I think it can be a little frustrating for cats that they just constantly pounce on this thing and they never can catch it. There's a fishing line where you like fish and then they go get it and they bring it back, you reel it in and they tug a little bit. So you can do almost like a tug of war with cats. They have little gloves that have little lures on the bottom of it that they can catch. You can play ball upstairs sometimes with some cats. You can throw the ball up and they'll run up and get it and then come back down. Any other things that you...
I know one of our technicians here has a giant like hamster wheel for her cat.
Really? And her cat goes in it?
And her cat goes in it, and it's really stinking cute.
Yeah.
It's huge, right? Because, I mean, they're not a hamster, it's a cat. But, like, it's really cool to watch him go in it.
So, and then there's another whole school of thought that says that cats actually shouldn't be just fed in a bowl that you put in the kitchen in the same spot every day. That you should make them, to some extent, hunt for their food. And so you put their food in a different location in their house regularly, and then they have to look for it. There's little balls that you can put their food in that they have to bat around, and they only get a few kibble at a time, so they do that to exercise. There's a whole food feeding system that's to make cats kind of hunt for their food as well. So all of those.
And that's kind of interesting because they do a lot of stuff in zoos now. They won't just
enrichment.
feed the animals. They sort of have like more of an enrichment program to give the animals their food or make the animals work for their food a little bit. I feel like so often our cats that are indoor only cats have really just like enjoyed the lifestyle, and they just are going to eat a bunch and lay on the couch.
But some of them have massive behavioral issues because of
true.
that, and you don't realize that there's a link to that. So while exercise from a weight management is important, but it's also important to keep them interested.
Right.
And it's actually stressful for a cat to be bored.
Right. Yeah, so I think that, so many people think that their cats are these like fat, lazy cats, and they can just stay around in the house, but they do still need that. Even though they seem like they're happy and they're just eating and sleeping, they do need some enrichment.
We're going to keep moving along. This is going to be a long episode, but we're going to stay here as long as people have questions. So first I just want to
stay here all night. We're not leaving. No bathroom break. Nothing.
Anne-Marie just said thank you, and Kristen also said hello. But so we have, what are you excited about that is new in dog care?
Oh. New in dog care. Jeez.
I honestly, I love, and this is in a similar vein as the cats, that I go to the pet store and there are all these fascinating new different kinds of toys. Like there's a whole category of puzzle toys.
Yeah.
And mostly my dog's not so smart enough to do them, but we're working on it. That, you'll get a little tree that has a bunch of squirrels in it, and they have to like go pull the squirrels out, and then now they've got 10 toys instead of just the little, and they stuff them back in, and they have to get the squirrels out again. That one my dog does just fine. There's other ones where they have to like push the little paws on a button, and then a thing pops up and they get a treat.
That is really cool. That is cool. I think as far as like the medical aspect of it too.
I'm sorry, that was
no, I mean those are cool. I like that. That is exciting. I mean there's just like human medicine, I feel like there's constant advancements in veterinary medicine, and being part of Ethos, there's a whole branch of Ethos Discovery, and sort of hearing some of the thoughts of what these scientists are trying to do and some of the studies, brand new tests for our canine and feline patients. It's exciting to think that we have new things that are coming, that are on the horizon, that they're working on to help them as well.
Yeah, those are fascinating, and you can go to ethosdiscovery.org to learn more about those tests, a lot around cancer, and it's really interesting. So we have from Brienne, what are your thoughts on yearly vaccines versus doing titers each year?
We also had a topic on that at one point, didn't we? Yeah. So, do you want to...
You can start.
So vaccines generally aren't yearly anymore. So that's one big thing, is that there are some vaccines that are annual.
Right.
For example, so most of the bacterial diseases are an annual vaccine because the immunity is just not that long lasting. Coincidentally, those vaccines do not have titers available to test. So Lyme, lepto, if you vaccinate for those things in this area, we do recommend them. You cannot do titers, and we do recommend those vaccines. That you do, go ahead with those. Kennel cough is another one.
Right.
If your dog's is higher risk for kennel cough, yes, you should get the vaccine, and no, there aren't any titers.
Yeah.
For rabies is generally not an acceptable disease to titer test for. It's kind of complicated to... Basically, there is no titer level that anyone knows what is protective. So you have this titer. The titer is proof that your animal has been vaccinated, but not that if your animal was exposed to rabies that it would be protected. And because rabies is so uniformly fatal in people and in animals, that is generally not accepted.
Yeah. And you would get post exposure. Your dog would get post exposure anyway. So I mean, it's kind of silly.
So you can't just take a titer to a town and say my dog can't get rabies. There are some towns that will accept it, but only if you have some proof that your pet is not able to be vaccinated because it's had a very severe reaction to rabies. And in that case, well, we can't vaccinate the pet anyway, so the titer's almost not that useful.
Yeah.
Distemper is one that you can, distemper parvo, you can do titers for.
Yeah, and that's sort of listed as our core series of shots, meaning, every dog really should be getting those vaccines. However, after your dog is probably around 5 or 6 years old, they've already had a couple of shots, worth of the distemper parvo, and maybe they have enough antibodies that they produce themselves that would be protective against those viruses if they were exposed to them. And so I do have some clients that will do distemper parvo titers. It's funny though, I mean, I've had some patients that are older, they have 10 or 11 and they want to do titers instead, and the titers, maybe for one of them is protective, but the other one is not. So it's quite interesting to see, well, this dog has been getting the vaccine protocol as we see fit, every 3 years. Well, initially getting it at that year mark, but then every 3 years, and they still just don't have enough of their own antibodies to protect them if they got exposed. And so it's not wrong to do a titer for those. It's fine. A lot of people don't choose to do it because they're just a little bit more expensive than doing the vaccine themselves.
Yeah, that's the tricky part is once you vaccinate the puppy, and then at 1 year of age you do, and maybe at 3 years or 4 years of age you do another vaccine, and then from then on you're going to do titers, right? So when do you start? Well, I would start when I would have given the pet the vaccine again, right? So I'd start at 7 years of age. Now you have to do it every single year, right? Because you need to know when the immunity drops. You don't just wait now 3 more years. And so every year you're spending over $100, maybe even $200 to do titers that the vaccine would have cost $25 every 3 years. So yes, we want to avoid overstimulating our animals, but my argument is that vaccine every 3 years is vastly lower exposure than your dog gets just from taking a walk and eating the poop that it's eating. So
yeah, and the distemper parvo I feel like is probably the most popular or widely used titer that we have, and getting that vaccine once every 3 years, not like you're giving the vaccine every 3 months, you're not.
So I know there's a whole topic about over vaccinating. We're not going to probably dip into that dramatically here because we certainly could talk for probably half an hour just on that.
It's true.
Do we have any other? We're vamping a little bit for time.
We're just having I don't know if there's a technical issue. There is a technical issue. We've got somebody
Are we still on TV?
On our camera. We've been kicked off of Facebook.
We lost network.
Oh. Some of that didn't go.
I could tell.
We're back on. Sorry.
Oh, sorry about that, everybody.
Do you know when we cut out in terms of our answer to that?
No.
Just at the very end, I think. We just
we were just saying that, we could probably devote a whole... We have talked about vaccination in the past on a previous one, but, the topic of over-vaccinating pets is probably something we could delve way more into in a future episode at some point.
So, 2 more questions, and then we'll wrap it up. And the last one is a good one.
Really doozy.
But let's start with Bill. Bill is looking to break into the pet industry, coming from the education field. He has a ton of schooling, an associate's, bachelor's, and master's. Do you have any advice?
Oh.
Well, so I guess it kind of depends on where in the pet industry you want to go. So, opening your own business, or just wanting to completely change careers and become a veterinary technician, or going back to school and being a vet.
Yeah.
I don't know.
Yeah, I think it's figuring out, definitely. I mean, that we have lots of people that have joined our team that have had previous careers, either as, accountants or teachers.
Marketing.
Everything. I mean, we've had, a lot of people that have come here, and this is sort of a second career. And we have some people that have become vets because of it. That we have one of our vets, she was a teacher before. We have a technician that, was an accountant before. So figuring out where you want to sort of fit in. And if you're not quite sure, I would encourage you to, talk to your vet. I don't know if you have a vet or not, but, kind of get a little bit of a feel of what it might be like. maybe, hang out for a day and kind of just see, what the atmosphere would be like. It can be tough. Or if you're thinking more of a business aspect or business side of it, there's definitely people that have come over from human healthcare into veterinary healthcare. So yeah, I mean,
there's so many aspects of sort of the pet industries, right? So there's lots of startups that are doing new and exciting different things in veterinary care, but also in different, toys for pets or that kind of thing. There's pet stores, that whole kind of industry, and then there's the business side of veterinary care, which, every hospital has a practice manager. Every hospital has, to some extent, accounting and that kind of thing.
Yeah.
And those are usually advertised on like monster.com or, various different employment sites.
If he's looking to be a doctor with a bachelor's and master's, he could technically apply to vet school. Is that correct?
Oh.
Yeah, you have to have certain prerequisites, so it depends what the bachelor's and master's were in. So most people that switch careers entirely do have to do some undergrad additional coursework. They don't have to get another degree, but they'll have to do a few courses in biology, biochemistry, and physics.
Yeah.
All right, last question. And if you still do have questions, you can continue to write them, and we'll try to get Krista and Lindsay to answer them throughout the day. So our last question, though, comes from Mike. And Krista, I feel like you'll be good at this. My Wookiee is losing some fur and scratching a lot.
Is that Mike Corcoran?
What flea products do you recommend?
I thought we were supposed to say the last name.
He's a doctor here.
Oh.
Do you know what a Wookiee is?
Sam, I can't believe it.
How can you test for seasonal allergies on his Wookiee?
That's fantastic.
So first, you need to shave the Wookiee. And we need to see what's under the Wookiee. Because that is a burning question that we all have.
Oh my goodness.
And then we will delve into all of the flea products that are available. But
That's
you
fantastic.
would have to at least go with a 5X product, 5 doses. And probably start at the head. And put some on the head, back of the neck, maybe, part the butt cheeks. We'll see. We don't know what's under the Wookiee.
It's fantastic. That's it.
All right.
She's wrapping us up. She's giving us a wrap.
Thank you very much, Mike.
Yeah.
So our next episode is going to be a tour of our new hospital, which we will not be doing. We don't think we're going to be doing it live. We'll be doing it like that MSPCA episode where we'll go around and then post it later. If you would like to subscribe to us, that would be very helpful to us on your Google Play or iTunes or wherever you get your podcasts. Rate and review us as well, because it bumps us up in the listening, whatever rankings.
And don't forget our sponsor, Ethos Veterinary Health.
And Ethos Veterinary Health.
We thank you very much. Thanks for joining us. Bye.